And I'd like to start by thanking my colleagues in New Zealand who I work with all the time on research integrity issues. I really couldn't do any of this work without them. And we don't have any conflicts of interest to declare. So 10 years ago now, we started investigating a research group from Japan, and in 2013 undertook a systematic review of 33 randomized trials from this group and wrote up a publication and submitted it in turn to 5 different journals. And only 3 years later did we manage to get it published. And the systematic reviews showed completely implausible productivity and recruitment rates, failure of randomization, extremely positive outcomes, plagiarism, all sorts of inconsistencies, and no evidence of ethical oversight. And it took 2 years or more to get an expression of concern. And eventually, one of the researchers admitted fabrication. And then in 2016, the systematic review was eventually published, and all the affected journals with trials were notified in 2016. So here's an example of the kind of evidence that we accumulated and published in our paper, showing the outcome of hip fracture. A lot of the trials were around different interventions for the prevention of loss of bone density or hip fracture. And up at the top here, you can see all the individual trials, A1 onwards, with the relative risk reduction for hip fracture, compared with, down at the bottom, the results from meta-analyses of similar interventions from large trials. And you can see how the relative risk of hip fracture from the trials we investigated was so much more positive, unbelievably reduction in hip fractures. And in fact, the 2 key researchers, Sato and Iwamoto, that we have investigated have 304 publications and are presently 4th and 6th on the Retraction Watch leaderboard. And you might say, well, there's 112 retractions from from Sato and 87 from Iwamoto, so you're 2/3 of the way there, but most of the publications have both names on, so we're only just over 1/3 of the way. And every single paper that we have investigated, we have found major issues with. But I'm going to focus on the trials. And the key question here is, what should systematic reviews and guidelines do about retracted citations when they find that they have been written and have included retracted citations in their evidence? And the only guidance I could find was from COPE, which said articles that relied on subsequently retracted articles in reaching their conclusions, such as systematic reviews or meta-analyses, may themselves need to be corrected or retracted. And that was all that they said. And the questions I have is, how do authors of affected systematic reviews and guidelines find out? And what should they do about it? So, to try to look into this, back now, more than 3 years ago, we searched the Web of Science, Scopus, and our personal files for citations of the 27 retracted trials and looked to see how many were included in clinical guidelines and systematic reviews in the evidence space, not just in the introduction or the discussion. And those retracted trials have been published between 1997 and 2012. And then 2 of us independently coded what we thought the impact was of removing those retracted trials, whether we thought the findings were likely to change, and the size of that change, whereas a substantial change was actually a change in the direction of the effect, and whether we thought a reanalysis of the meta-analysis was needed. And then from September 2020, we set up monthly emails to a maximum of 3 to the contact authors. If we got a reply, we stopped emailing people. But because we didn't know who to contact or how many people to contact, we also undertook a randomization. So we always emailed the contact author, but it could be with or without 2 contact authors, 2 other authors, or it could be with or without the editor of the journal or the lead for the clinical guideline. In our emails, we listed the retracted citations, we included the affected paper, and we highlighted the references in the text. All we did was ask them to acknowledge receipt and whether they thought anything needed to be done. And then we followed up from emails for 1 whole year from the date of the first email. And we looked to see if we got any reply, the time for the reply from the first author or for any reply, and what action was undertaken. And we also analysed themes that came up in the email replies that we got. And here's a flow chart demonstrating from the 27 retracted trial reports, we found over 1,000 citations, eventually whittling this down to 88 systematic reviews and guidelines, which themselves at that time had more than 11,000 citations. And then we randomized 40 emails to the contact author and 42 to 3 authors. Some of the systematic reviews didn't have 3 authors, and randomized to editor or not. A couple of papers, one had been retracted before the emails were sent out, and one had become aware that they were affected before the emails went out. So we actually ended up only emailing 86. And here is an example of the kind of thing I'm talking about. You don't need to read this, but this is just an example of an agency for healthcare research and quality clinical guideline that was also published in the Annals of Internal Medicine in 2008, in which the guidance for patients at increased risk of falls in terms of fracture prevention came from 6 retracted trials out of a total of 7. And so all the text in red is provided by the retracted publications. Okay. So very few of our examples had just 1 retracted trial in the clinical guideline or systematic review. 10 of these papers had cited a trial report that had already been retracted. So they really should have been able to pick this up. Around a fifth were clinical guidelines, usually around fall or fracture prevention, but also managing patients with stroke, providing nutrition support for older people. And in the systematic reviews and clinical guidelines, the subsequently retracted trials were usually assessed as low or moderate risk of bias. No citing publication had documented integrity concerns. There's a lot of information here, but basically, in our assessment of the impact on citing publications, the thing to do is focus on the right-hand column and the numbers in red. And 45 or around half of the systematic reviews and clinical guidelines, we reckoned the findings were likely to change. And in 39 of those 45, 87% So very nearly half, we thought that this effects would substantially change, i.e. there would be a change in the direction of the effect. So we thought, based on our assessment, and we are systematic reviewers and we're used to doing this kind of thing, that there would be a fairly large impact from these retracted citations. Okay, so what was the outcome? If you just focus, for example, on whether we got a reply, up on the left in red, you'll see that if we just emailed the contact author, 40% replied. If we included 3 authors, 62% replied. So this was a difference. Whether you included the editor or not didn't make a difference. There was absolutely no difference in the time to getting a reply between emailing 1 author or 3 authors, including the editor or not. It didn't make any difference. Nor did it make any difference in terms of numbers of replies or times replies from first. Nothing really made a difference. And what effect did this actually have in terms of actions? And again, you'll see that on the right column here, we got no reply from nearly half, despite our 3 emails. And in terms of action, 2 planned a notice, but this notice had never actually been published. 3 published a notice, 5 published a letter, and 1 published a retraction. So 9 publications took action. 4 of those 9 had findings we judged likely to substantially change, which means that 35 out of 39 where we thought the findings were likely to be substantially changed had not taken action. And in 5 of those 9 cases, the letter or the notice was not linked to the publication online. So you wouldn't find it unless the indexing system had linked it separately. If you just looked at that journal article, you would never know. And here are some of the comments from emails that we got back. So quite a number said that they thought there was minimal or no impact. They didn't think they needed to do anything. But we had thought that 3 of those had been substantially impacted. Rather alarmingly, I think, 7 didn't appear to involve the contact author in their decision-making process. 5 said that this was all too long ago, but in fact 4 of those have been cited this year. Some asked what they should do. Some already knew the tractions but had not done anything. Others said they had no resources to update a systematic review. In 3 cases, it was clear the editor was driving what happened. And in 3 cases, the authors had stated that the retraction cited before the retraction occurred. So actually, they didn't need to do anything. I've just looked actually to see what happened now, which is 30 months after we started the emails. And there have been 2 more notices, both attached to ARHQ publications, one of which is the companion publication to the Annals of Internal Medicine paper, which I showed you. But the Annals of Internal Medicine paper still has no notice attached to it and is still being cited 15 years after publication. And actually 56% of uncorrected publications have already been cited this year. So all along, I'm having this discussion with myself. As a researcher, what responsibility do authors and publishers and institutions have for their past publications? This is a more general issue than just systematic reviews and guidelines. What responsibility do we have if we discover that there's an error, that something needs to be corrected? Okay, so that's what we found. And here's some of the things that we've discussed and thought about, and some ideas we have for how systems could possibly change. In 39 of our 88 studies, the effect sizes would likely be substantially different if the retracted trials were removed. But after 1 year, and after all, a year is a long time, only 9 had notified readers, and that's only 4 of the 39. We didn't find that including more authors or the editor increased the likelihood of notifying readers, but our trial may have been underpowered to do this. We could only work with the studies that we had. But our original concerns were raised in 2013. And in fact, for the group of authors that we investigated, people had been raising concerns as far back as 2007. It still took more than 2 years before there was any published notice attached to these trials, despite impossible data. And as of now, 4 of these 33 randomized trials, which are no different from the others which have been retracted, are still unretracted. And so there are 2 in the Journal of Neurological Sciences, which, as Xavier said, it would retract in 2020. And there are 2 in Osteoporosis International, which is a Springer journal, with absolutely no evidence that the journal intends to do anything about them. So what are the limitations of our study? Well, we don't know if the emails we sent were treated as spam. I did my very best to make sure that I used current emails on the websites and checked that these were still used by corresponding authors in recent papers. And if emails did bounce, other authors were emailed. We don't know which parts of the systematic reviews or guidelines were subsequently referenced. It was an impossible task to look at 11,000 citations and see what parts were citing. Well, maybe with AI you could do it now, but that's not within our expertise. There really is minimal guidance on what to do about this, and maybe authors of guidelines are so much in the dark that that's possibly an excuse for not undertaking some attempt to update things. And perhaps they thought that our case has had lots of publicities, and maybe authors and journals may assume that readers will already take this into account when seeing cited studies by Sato and Iwamoto. There's actually very little work in this area around the evidence of retracted papers in guidelines and systematic reviews, but I'm glad to see that there are more publications coming out. Finelli published an analysis of retractions in 50 meta-analyses and didn't find overall a statistically significant effect, but almost all of these had just one retracted publication in the systematic review. And I think the effect of retracted citations is very much case specific. In the case we examined here, there are often several trials with very large effect sizes in each citing publication, and there are relatively few trials from other authors. So here's some suggestions for what we think might need to happen in an ideal world. And I think the first thing is really systematic review authors should always ask themselves, are these results plausible? Are they real? Do we really expect vitamin D to produce an 80% reduction in hip fracture? No. risk of bias, but particularly the Cochrane risk of bias, does not ask questions which really tease whether one thinks there are integrity issues in studies. And I think systematic review authors need to be very clear that they should not rely on evidence from one research group or one country in terms of results. And I would also add too that it's really important to have a subject expert examining data. We have several examples in our integrity work, not just in this case, but other cases we have helped with, where journals have asked statistical referees to look at data, which is absolutely impossible from a biological perspective, but statistically seems to be okay. So I think it really is important to have a subject expert always look at data. And when I was first learning to do Cochrane systematic reviews, I was told by our head of department that he thought it was a bad idea to have clinicians involved in systematic reviews because they always wanted to find what they wanted to see. But I think really we absolutely do have to have people who understand the numbers in terms of, does this really relate to what one would expect to see in the real world? Clearly, and everybody knows that to mitigate the consequences of integrity concerns, retractions, expressions of concern or corrections really have to be published a great deal faster. And we would say that it is really pivotal that you don't await evidence of misconduct. If you have publications where there are clear integrity issues, one really has to warn the readers by at least an expression of concern. Now, it's an issue still that a lot of the bibliographic databases and search engines do not consistently and rapidly record integrity notices. There are more gradually, and I've listed them here, and they're linked to Retraction Watch's database, which has far more retractions and notices than PubMed or Embase. One of the issues that arose in our work is clearly that guidelines are not cited by bibliographic services in the same way as a synopsis of a guideline that's published in a journal, which means that it's really hard to trace these publications. And if one was going to do some kind of mail alert to people or citation alert from a bibliographic database, it just wouldn't happen. I would always say now that authors undertaking systematic reviews should search Retraction Watch's database and PubPeer for every one of the studies that they are going to include. And for the journals, then at manuscript submission, they should require that authors confirm that they do not include retracted citations. In systematic reviews and guidelines, we think this ought to be included in the PRISMA flowchart. And we think at submission that journals should require authors to confirm that they will provide an update note if a citation is subsequently retracted from their systematic review. And publishers should also check for retracted citations prior to publication. Now, our process of emailing was perhaps an attempt to mimic some kind of automated alert from bibliographic databases or publishers, which could go to systematic reviews. In fact, in an ideal world, they would go to every publication that has cited something which is subsequently retracted. But as we've shown, actually very little happens. just from that alone, but it could be part of a series of measures to try to mitigate the impact of retracted citations. And we and also Jodie Scheider's group have basically said that we think that if systematic reviews or guidelines include a retracted citation, then there needs to be a note put against that publication to warn people, and that note stays there until the authors of the systematic review or guideline say whether their guideline or systematic review has changed or not changed by removing that retracted citation. So a kind of reliability flag. And in fact, the Cochrane Pregnancy and Childbirth Guidance is essentially doing that, putting a flag on their systematic reviews that have included a subsequently retracted trial and requiring authors to provide some kind of comment within 6 weeks to say the impact of that trial. We're not saying that people necessarily have to do a completely updated systematic review or meta-analysis, but the authors should be able to provide some kind of comment upon the impact of that retracted citation, because it shouldn't be left to the readers to figure it out. And finally, I think really it's beholden on systematic review and guideline authors to inform key stakeholders if they have made important changes to their guidance or systematic reviews as a result of retracted citations. So that's the end of my talk. Between myself and my colleagues in New Zealand, we have a blog which we use to highlight some of our issues that we come across. And here's the link for the publication and also our checklist that we use for assessing the integrity of studies. So although I've concentrated on systematic reviews and clinical guidelines, it's really as an exemplar. And I think a lot of these issues are actually pertinent to all kinds of research. Thank you very much for listening to my talk, and I'm really interested to hear what you think.